Okay, first thing for the ABG draw, what I'm going to do is look at the patient's chart, make sure that the doctor has already put an order in for it, and then collect my supplies and go ahead and enter. Oh, when I'm looking at the patient's chart as well, I'm going to go ahead and look at their history, check their medications that they're on to make sure they're not on any blood thinners or anything like that, because that will make a little bit of a difference when we go in to take the blood sample. So once I collected my materials, I'll go ahead and enter the patient's room. I'll knock, I'll introduce myself. Hello, Mr. Skellington. My name's Kate. I'm with the respiratory care team here at the hospital. Today it looks like Dr. So-and-so prescribed or set in an order for, we need a arterial blood sample from you to check your oxygen levels in your blood, okay? So the first thing I need to do, it's a little bit different than when the nurses draw blood. I can't use the blood sample that they just took from you. I need to check, this is from your artery, not your veins that the nurses use. So first thing I need to do is just to check your veins or your arteries and make sure that there's a good collateral return. So if you don't mind, I'd like to take a look at your wrist and check that. Sure, that's fine. So I'll go ahead and wash my hands, put on gloves, and perform the Allen's test on the patient. Now that I can see that there's good, or that he had positive results from the Allen's test, that means he had good collateral return from the ulnar artery. I'm going to go ahead and do my blood draw. So I have my blood or ABG kit. I'm going to go ahead and open it up. I'm going to get a towel here and place the patient's wrist on a towel. I have, I'm going to fill out the patient label, put the name, I'm going to take the patient's temperature, room number, date, and time that I took the test. I'm going to go ahead and place it on my bag already, so I'm ready to go. I have some gauze on my towel. I'm going to put the Band-Aid already prepped and ready, and the cap and everything. So I'll go ahead and palpate for the radial artery. I have it here. I'm going to go ahead and clean the area with the alcohol, make sure the alcohol dries before I insert the needle. I'm going to take the cap off the needle, pull back the syringe to 1.5 milliliters. We at least need 0.5 milliliters to have a good and accurate blood draw, so just to keep that in mind. I'm going to make sure that my bevel is facing upward. I'm going to hold the needle like a pencil. Okay, Mr. Skellington, on the count of 3, I'm going to go ahead and insert the needle. 1, 2, and 3. Insert at a 45-degree angle. Make sure that the blood fills up. I already have everything prepped and ready. So I'm going to put some pressure down and take my needle out. Keep the needle away from me, and I'm going to cork the needle. I'm going to hold down pressure on this artery for 3 to 5 minutes. I'll go ahead and put a bandage on it. And now I'm going to get my sample. I'm going to cap it. I'm going to examine it, making sure that there's no air bubbles, tap it a little bit. I'll put it in my biohazard bag here, seal it nice and tight, has a label on it already. And then I'm going to go ahead and get my my corked needle and throw it in the sharps container. Now I'll go and address the patient. Mr. Skellington, are you comfortable? Thank you for letting me get that sample, and we will be back with you shortly with some results. I'm going to go ahead and send that off to lab. So I'll take that towel away, making sure the patient's comfortable, that he has his call light in reach. I'll take my gloves off, wash my hands, take the sample with me, and send it off to lab.